I'm delighted to welcome our panel. Our panel have been very much involved in developing the content for the themes that we've all attended over the past 2 days. But first of all, I'm actually going to go first to theme 2, to Alastair Kent, who discussed game changers in diagnosis. Many of you will know Alastair. For those of you who don't, Alastair Kent is an OBE and he's the director of the Genetic Alliance UK, the national charity of over 180 patient organisations supporting all of those affected by genetic conditions. So your thoughts, Alastair?
Yes, thank you very much, Avril. I was sitting through the theme 2, the importance of diagnosis, and a number of, I think, key messages came out of the excellent presentations that we listened to. Diagnosis is a potentially life-changing event for families. When you know you have a child or a family member where there's something that you can see is seriously wrong, but you don't know what it is, you don't know what the implications are, then you search for a diagnosis. And that diagnosis can bring with it opportunities. It can bring with it insights that you wouldn't have. It can enable you to understand what's happened to you. It can enable you to plan for the future in a way that you can't do when you don't have a diagnosis. It can also bring devastating news. It can confirm that you or your child or your loved one does have a life-limiting disease, that they are going to progress and that their life may be short and impaired by all sorts of currently unavoidable developments. So from the diagnostic theme, the key messages are, first of all, that we need to improve the speed and accuracy with which we are able to make a diagnosis. Too many patients spend too long, too many families spend too long waiting for that news, not knowing what to expect, not knowing how they can cope with it. We also need to improve the ability by which we transfer scientific understanding into clinical practice. We need to make sure that our clinical laboratories are equipped with the necessary technology, with the personnel, with the skills, the knowledge, the experience to be able to give accurate, reliable information for clinicians and for patients and families to act on. In a research laboratory, you're allowed to make mistakes because you're dealing with uncertainty. You're creating knowledge, not necessarily transmitting it immediately. In a clinical laboratory, the consequences of a mistake can be devastating. So we need to make sure that when we do generate new knowledge, it is translated into clinical practice in ways that are robust and that we can all rely on. And we also need to be able to address the inequity that exists across Europe and around the world. Unfortunately, what you can access by way of services and support in order to get you to the point of diagnosis often depends as much on where you live as what condition you have and you're affected by. Too many people in too many countries struggle to get to the point where a clinician can work with them and say, we know what this is and we know what we can do about it. So we need to address the scientific research that will produce the robust diagnostic techniques. We need to address the infrastructure concerns that will ensure that those robust diagnostic techniques are able to be delivered in a competent clinical setting. And we need to address the inequalities that mean that for too many people in too many parts of Europe and the rest of the world, their access to information, their access to understanding is constrained not by what we know or what we don't know, not by our current scientific opportunities to discover, but simply by the inequalities that families face based on geography, wealth, and other non-relevant non-clinical factors. So those are the take-home messages from our strand, and I hope that we can work together to progress them and address them in ways that will ensure that families are likely to be able to access timely, accurate, reliable diagnoses universally.
Thank you, Alastair. We're going to move now to theme 1, and Hugh Dawkins was responsible for that theme. So, Hugh, what do you think were the game changers? What came out of your session? And just to say that Hugh, for those of you who don't know him, is a PhD, is the Director of the Office of Population Health and Genomics at the Health Department of Western Australia. So you're very welcome.
So thank you, Avril. Our theme was, theme 1 was the game changers in research, and it won't surprise you to hear that the game changers in research are not very different from the game changers that Alastair described. And I present them from the perspective of, if you're a researcher and you're involved in research, then the game changers is achieving is not about the diagnostics, it's about a diagnosis. And if you have that as a firm vision, then you will be working with the clinical community and the patient community to achieve an accurate and an early diagnosis. This is still, out of all of the themes and out of all of the discussions across these 2 days, this is still the most defining moment, is that an accurate diagnosis. It's the portal to the patient's best care. And so from a research perspective, what can you focus on to help to achieve that? You can focus on analytics, and you can focus on bioinformatics, and you can focus on a whole lot of other tools. But really the objective of that is a safe, an accurate and an early diagnosis. And it works, and it addresses the needs of the patient. It addresses the needs of a health system. It addresses the needs of industry in doing this. And so it is probably the most, it is the standout theme or issue in terms of a game changer. The second game changer is clinical data. There's a need for clinical data so that we can actually, it relates to and is related to what we're talking about for a diagnosis, but it's also needed, what we need in order to be able to access this data and to be able to share this data is we need a policy framework. We need policy frameworks that will enable us to be able to safely and engage with sharing data that is critical for patients around the world, particularly when we're dealing with small numbers of dispersed population. So those patients around the world achieving that diagnosis. One of the other things it does, which is really critical in this space, is that it provides certainty and safety for doctors to practice in a way that is going to be aligned with the patient needs. And that's what I'm talking about in terms of the dispersed nature. There may be only one patient in a community or one patient in a country, and in order to achieve the best practice guidelines, in order to get a diagnosis for that patient, in order for the doctor to help to understand what that patient's journey might be like, we're needing to be able to share data. And so we need to de-risk it for the medical community, and we need to de-risk it for government. And to do that, that's a policy decision. And so now, as rare diseases begins to mature, we need to start thinking about the policy implications and building the policy frameworks in which all this technology and knowledge can live. And part of that as well is sharing evidence on health technology assessment. Everybody is doing a health technology assessment on the same issues, on health, the health economic data, and on health system impact of rare diseases, and on the family impact, the social impact of rare diseases. We need to start to share this data more and more. And then the third one is that we got from the theme 1 and from across the sessions was, and this is drawing on that, is the need for precision public health policy. And what I'm talking about for precision public health is to be able to use the new lens that we have from the knowledge that's being developed to be able to make the policy decisions and to develop policy frameworks that are going to allow us to put these practices and these new practices into action in our, across our health system, across our patient support system, across our social support and our workforce. Because rare diseases and the work that's coming out of rare diseases isn't just changing the lives of the patients, of people living with rare disease, it's changing the lives of the clinicians. I don't think that you yet understand, and we yet understand, the transformative and the massive changes that's going to be in the workforce, and of the transformative change that can come about through rare disease research. And so it's by developing precision public health policy that we're going to start to see it. I'll give you one quick example and then I'll hand over. But, you know, the European reference networks, which is a European Commission decision, is linking up with the rare disease clinical research networks in the US. What a massive undertaking that's going to be, and how important and how powerful that's going to be. Underpinning all of that, though, is going to be human phenotype ontologies, which is a system that's been written by a clinician in Europe, in Germany, and it underpins just about all of the developments that we're going to need for precision public health policy, because it defines a language by which to talk about the disease conditions. And yet it's sitting there, and it's going to need to be supported, because it's one of the pillars by which we're going to be able to develop these policies and be able to make these changes and be able to enable that ERN, the European Reference Network, and the rare disease clinical reference research networks across these in that transatlantic space to be able to talk to each other, because it's developing the common. It contains the common language, yeah. And it's And it is that language that's going to be facilitating timely ascertainment and standardisation